and then I could put it on YouTube. It'll just take me a little bit once we go off for it to load up, and then you could go back and watch it. At least you can watch what we do from here.
Okay.
So cover the scale. You only gonna put a warm blanket on the scale.
Why wouldn't you? What happens with the baby? First of all, how do babies keep warm?
What is it? Conduction.
So they have brown fat that they use,
Brown
right?
fat, right?
Okay. What happens when a baby touches something that's cold or gets near something that's cold?
That's when they lose it, right?
They lose their heat because the coldness transfers to them. So
Right.
scales are made with a tear on them, something called a tear. So you put the scale on, you put the blanket on the scale, okay, and then you weigh the blanket, and then you hit the tear, and then you put the baby on. The tear takes the weight of the blanket off and just weighs the baby. This way you can put the baby on the scale naked. You don't have to worry about losing as much heat. You're still going to lose some, okay, because we lose weight through conduction, evaporation, all right, a few other ways. So that's what you have to think about.
Gotcha.
Okay, so let's pick one. What else?
What about 2?
2 is called kangarooing.
Mm-hmm.
Okay, kangarooing promotes that warmness for the baby. It helps stabilize, gives them that thermoregulation, plus it helps bond. This is something they use a lot with pretermies. This is how they kept my nieces alive when they were born. 3, well, one of them didn't make it, but the other 2 did. But they did it through kangarooing because they realized that the babies lose a lot when they're in these NICUs and they're not getting that skin-to-skin contact with mom and dad.
Mm-hmm.
All right, what about 3?
Yep.
So why do we use radiant warmers?
To keep the baby from losing heat. Well,
and they're easy to access. As the healthcare worker, we can go right up under there because the light is over them and it kind of shines down on them, warms down on them, okay? Whenever you put them under radiant lights, you do have to be careful about sensitive parts of the skin, like the groin, the eyes, stuff like that. But, you know, for diaper changes, that's a great place to put them. You can easily access it, change it, and they don't lose that body heat from radiation. All right?
Mm-hmm.
What about 4?
Mm-hmm.
You need to dry them off first.
Okay, because why?
Because of like the radiation between
evaporation.
Like
Evaporation.
Yeah, evaporation
Okay.
between the fluid
Yes.
on the baby.
Yes. Okay. How about 5?
Open, yes. Yeah.
I would say you're probably going to have a closed incubator if you're taking them to NICU.
35 weeks gestation. Yeah.
I don't like the openness.
Okay. Yep, there you go. Perform. Full chest. Take a picture.
Good.
Mm-hmm.
A pregnant client is brought to the emergency department by ambulance after her water broke. She is screaming and bearing down with every contraction. Which of the following assessment questions are essential to ask in preparation for the birth and possible newborn resuscitation? Select all and apply. Did you receive the influenza vaccine during pregnancy? Do you take any medication or illicit drugs? How many babies are you expecting? What color was the fluid when your water broke? When is your due date? All of those seem appropriate. Well, not during pregnancy. Well, Did you receive the influenza vaccine during pregnancy? Which of the following assessment questions are essential? So when is your due date?
Mhm.
Would give them an idea of how many weeks she is. What color was the fluid when your water broke? How many babies are you expecting?
So let's read your question again.
Which of the following assessment questions are essential to ask in preparation of the birth and possible newborn resuscitation?
So newborn resuscitation, what kind of things would prompt that? What would we be concerned about?
Do you take any medication or
Yeah.
illicit drugs?
The respiratory distress syndrome, right? Or something
Right.
along that lines that we're thinking that the baby might be born with. So what would be indicators that might lead to that?
Number 2, do you
Drugs.
take any medication or illicit drugs?
Yeah.
And
What color was your fluid?
what
when your
color
water
was your
broke?
fluid when your water broke, Nate?
Mhm.
I think so.
I think that's about right.
How many babies are you expecting?
Mhm.
Because when you're carrying more than one, um, sometimes there could, I don't know, I kind of feel like 3, 2, but I guess we can leave it at 2.
Okay, well, if I want to prepare for birth and resuscitation, I might want to know if she's expecting more than one. Because otherwise I might only have one set up there. And am I going to have time to get additional ones? So I think it's a good choice if you're thinking it through. And so what if you're wrong? Be wrong now, we'll learn it.
Mm.
Right, and I think the flu shot is fine in pregnancy.
Yep.
Yep. Oh, okay. McCormick's. Fetal stress and hypoxia during labor. Okay.
The nurse is performing assessment of several clients during routine prenatal visits. Which client should the nurse discuss with the healthcare provider first? A client at 30 weeks gestation with darkened patches of skin on her face. A client at 32 weeks gestation with painless, fresh flesh-colored bumps on the perineal area. A client at 34 weeks gestation and intense itching on the hands and feet that worsens at night, but no rash. And a client at 30 weeks gestation with stretch marks on the abdomen that have become reddened and puretic. So which client should the nurse discuss with the healthcare provider first? So number 1, the darkened patches of skin on the face, that's normal.
Mm.
Okay.
At 32 weeks, painless, flesh-colored bumps on the perineal area.
Mm.
Yeah. 34 weeks, intense itching on the hands and the feet that worsens at night, but no rash. I'm not gonna run and discuss that right away. And a client at 30 weeks, 38 weeks gestation with stretch marks on the abdomen that have become reddened and puretic.
Mm.
So
That.
2 and 4 is kind of jumping out at me.
Okay, so 4 is normal or abnormal? Stretch marks, red stretch marks.
No. Red ones?
Right. They
Well, it
kind of.
depends on the color of your skin. I'm
Yeah.
going to have red stretch marks.
Oh yeah, okay.
I'm a straight up white girl when it comes to color. Probably nothing else. 4 is, you said normal.
Well,
I mean, 3. I mean, 1. I'm sorry.
Yeah,
Yeah,
one,
that's fine.
I meant to say 1.
right,
4, I would consider normal.
okay.
All right. So now you got 2 and you got 3. Okay. So what do you know about itching on the hands and feet? What is that associated with? Especially severe itching.
Mm, It could be now it has no rash, so it's not syphilis. But it come with severe
Liver function.
liver.
Now, I was thinking that, but I
Liver.
thought that was throughout the body, not just the hands and feet.
Normally, like I always worry when somebody tells me they have a lot of itching on their hands and feet. I always worry about it. Okay. 2 is probably some kind of warts. Not life threatening.
Mm,
All right. Yeah, you don't like it. It might not look pretty, but is it going to kill the patient?
okay.
Which one has the potential to be most harmful to the patient? You know, which one do you need to address now? What can wait?
So 3.
Mm. Okay.
I always thought the itching was like throughout the body. I didn't know specifically hands and feet with the liver, like when you have cirrhosis.
Well, you could have it throughout the body, but it's going to be more intense on the feet and the hands.
I know that.
A nurse is admitting a client of 42 weeks gestation to the labor and delivery unit for induction of labor. What is a predictor of a successful induction? Bishop score of 10, firm and posterior cervix, history of precipitous labor, and reactive non-stress test. 42 weeks gestation to the labor and delivery unit for induction of labor. What is a predictor? Reactive non-stress test? No. A successful induction.
The bishop score of 10 because 8 and greater, you're more likely to have a vaginal delivery.
Okay. What do you think, Felicia?
Firm, huh?
What do you think?
Firm
Don't
and
worry, I can always change that dot.
you're fading away. I didn't hear you. Firm and posterior
Is that
cervix,
better?
I want to say is out. And history of precipitous labor is out. So I would stay with Nate's answer, yeah. Bishop score of 10.
Okay, good job. All right, so when the bishop is present, the baby is ready.
Mhm.
All right, bishop arrives, the baby is ready. Remember what most of these, again, you have to know the test, but most of these tests, the higher the score is usually the better. Right, so if you don't know if you can remember that it's the bishop score, if you don't always know the score, just knowing that usually higher is better. Of course, this, you kind of have to know the scale, but still, 8, 10, you're thinking that's a pretty good score. All right, because scores don't usually go up much above 20 on any of these nursing scales.
So
Right,
even if it's a 6, that's still pretty good.
This says for nulliparous. So if she hasn't been pregnant before, right?
Right, okay.
It's greater than 6 to 8.
The nurse is reinforcing instructions to a client at 34 weeks gestation who is preparing to travel by airplane. Which of the following instructions are appropriate? Avoid getting up during the flight unless you need the restroom. Carry a copy of your most up-to-date prenatal record. Increase fluid intake before and during the flight.
Mhm.
Secure the lap belt below the abdominal and across your hips when seated, and wear compression hose and loose-fitting clothing. Okay, so
So they're asking you about one thing here, right?
Reinforcing instructions and preparing to travel by airplane.
What are they asking you about? Come on. Come on, nurse. Read into the question here for me. What are they worried about when you're flying at 34 weeks gestation?
Getting the clock.
A clock.
Yes, ma'am. So they're asking you about ways to prevent a DVT. All right. You have to see that in the question so that you can answer it appropriately. And if you can't see it in the question, you should be able to see it in the answer.
Mhm.
Okay.
So you're going to increase fluids. Secure the lap belt
A lap belt.
below the abdomen, right?
Below. Mm-hmm.
Wear compression hose and loose fitting clothes.
Yep. It's always good to, it's always good to carry your prenatal, your record, just to
Mhm.
make sure,
You want to get up and walk, so that's not a no-no.
Right.
Okay. Good job. And here's your last one that wasn't up there. Avoid traveling to Zika or malaria and remote areas with poor medical care. First of all, I ain't getting on no plane if I'm 34 weeks pregnant. Forget that. Whoever want to see me better come where I'm at. And I ain't going to be 34 weeks pregnant, so I don't have to worry about it anymore. But
You stuck. Okay, the graduate nurse GN is assisting the nurse preceptor to provide education to a client diagnosed with a molar pregnancy. Which statement by the GN requires the precipitating nurse to intervene? A uterine evacuation procedure is the typical treatment for removing the abnormal tissue. We could provide you with resources for coping with perinatal loss if needed. You may start trying to conceive again as soon as you and your partner feel ready. You will need a RH immunoglobulin following the molar pregnancy because you have a RH negative type blood.
so what is this molar pregnancy?
Well, that's not good.
like a non-viable,
Okay, it's a non-viable pregnancy.
right?
Okay. It develops in the uterus and there may or may be a baby, but may or may not be a baby, but either way, it's not going to survive.
Right.
How's the mom going to start to present? At first, she'll be normal, right?
Mm-hmm.
And then what?
Bleeding.
Then
Okay.
the bleeding.
Yep, she's going to start bleeding. All right. And she might have some nausea and vomiting. All right.
Well, you may start trying to conceive again. As They
You
don't
get
want you to get pregnant for up to a year.
right.
And what about 4?
That you will need. Yeah, you will.
Yeah,
You
well,
will need that.
I was getting ready to say 4 is true,
Really?
regarding,
Everybody that has a molar pregnancy has RH negative blood?
no,
No,
it's
that's not.
because
Wait a minute.
you
Wait a minute.
have, I thought it was just her blood type, RH negative.
Does a molar pregnancy have anything to do with RH status?
No, because there's no blood crossing. There's no blood. It's no blood interacting with yours, right?
Okay, RH is when mom is one type and the baby is another type.
Right.
Okay, so that blood can't cross. So we're only going to give that globulin, number one, after they have the baby or anytime during the pregnancy, like if you're doing an amniocentesis or something like that, and there's a chance that the baby's blood will mix with the mom, that's when you're going to give that RH factor. Okay, but mom is negative, baby's positive, or vice versa. Okay, it's not going to happen just because the person has a molar pregnancy. One has nothing to do with the other. Not everybody that has a molar pregnancy has an RH negative baby, nor are they RH negative. You might blood type them because they're going to bleed. So you might want to know if you have to give them blood, but they could or could not be RH sensitive. It's not just because they have a molar pregnancy doesn't mean they're also have an RH issue, is what I'm trying to say.
Right.
So get rid of that one. Because I don't feel that's your answer. And you already got rid of 3. So now you have
No.
1 and 2.
No, 3.
No, we keep it.
No, 3 is the answer.
Right.
Oh, intervene. Oh,
Yeah,
I'm sorry.
intervene.
See, your teacher didn't read the question. Okay. All right. Good job then. Good job taking me down the right road. You see how easily you can leave that word out. So I say once you pick your answer choice, go back and just read your question again, just to make sure that you're answering what your question actually asked you. So that is a valuable lesson there. All right. Because a lot of times we don't, and we think the question said one thing and we answer it and we're like, I don't understand. I got that question right. Then when you go back and read the question, you're like, doggone it.
Mhm.
A client at 34 weeks gestation reports constipation. The client has been taking 325 milligrams first sulfate TID for anemia since the last appointment 4 weeks ago. Which recommendation should the nurse make for this client? Decrease daily diary intake, increase fruit and vegetable intake, moderate intensity regular exercise, 1 laxative twice daily for a week, and 2 cups of hot coffee each morning.
Mm.
So she's constipated. She's taking the iron. So we need to decrease. She's taking iron. If we increase fruits and vegetable intake, that might help with the constipation. A little exercise helps with a constipation.
Mhm.
1 laxative twice daily for a week is not an option, and 2 cups of coffee and each morning will not help with constipation, I don't believe.
Besides that, it's loaded with caffeine, so I don't think that's a
Right.
recommendation you're going to make to somebody pregnant.
Decrease daily dairy intake. I would stay with the 2 I have.
Okay,
Mhm.
anybody else?
No, I'm with you.
I tell you, I don't hear you back there.
Constipation. Yeah, I'm just gonna leave it.
Okay, good job.
Mhm.
Okay, so right there you got 1, 2, 3, 4, 5, 6 things about that, right?
Mhm.
You notice that it's always 5 or 6 things about it.
A nurse is caring for a client at 30 weeks gestation who is admitted for preterm labor. Which of the following interventions should the nurse anticipate? Administering IM betamethasone, administering penicillin via IV piggyback, assisting with artificial rupture of membranes, initiating IV magnesium sulfate, obtaining fetal heart tone once per shift. So 30 weeks gestation, admitted for preterm labor. Which of the following interventions should the nurse anticipate? Number 1,
Mhm.
Okay.
Number 3,
I'm kind of on the fence about that. I'll pick it, but I'm kind of on the fence because she's 30 weeks. I'm thinking we're going to want to try to slow it down.
Give her the magnesium.
Yeah, that's what I was kind of leaning more towards because I'm thinking we would want to slow it down. We wouldn't want her to go into labor yet if we can prevent it, is what I'm thinking. But I don't think you would do 3 and 4. I think you would do one or the other because they're kind of opposite things. But we'll just pick them and we'll see what it says because, you know, we're not under exam here. I'd rather be wrong and learn it. All right, what else?
you have to do the heart tone more than once per shift. So,
More than once?
I would, yeah.
So final answer then? I don't hear you, Felicia.
I don't think I would take the artificial rupture of membranes because this is preterm and assisting with breaking her rupturing her membranes. I don't think I would do that.
All right, so let's take it off. So the only one you missed was the penicillin.
Oh, penicillin. How we getting the penicillin? Oh, that's right.
Yeah.
Just in case.
Okay, to prevent strep.
Group, that's right, because it's at 36 weeks.
Okay, so think
Oh,
about, you know, what's happening here so that you can make a decision. You want to talk yourself, analyze that question. Okay, what's going to happen if I do this? What's going to happen if I do that? Now, remember, magnesium, okay, if you know about your electrolytes, then you know that anytime magnesium is increased, okay, it's going to slow things down in the body. All right. That's why we give magnesium to people that are at risk for seizures and preeclampsia because it brings stuff down. It sedates them, brings their blood pressure down, okay, brings their risk for seizures down, okay. If we're having contractions, it can slow them down. It can bring that labor down, okay. So increasing magnesium is going to bring things in the body down. It's going to slow them down.
Which client?
Oh, go ahead.
Which client in a prenatal clinic should the nurse assess first? So the client at 11 weeks gestation with backache and pelvic pressure. Client at 16 weeks gestation with earache and sinus congestion. The client at 27 weeks gestation with headache and facial edema. And a client at 37 weeks gestation with white vaginal discharge and urinary frequency. So assess first. 11 weeks backache and pelvic pressure, I probably wouldn't assess that first. The earache or sinus congestion, I wouldn't assess that first. The headache and facial edema has me questioning whether I should see her. Why is her face swollen? And the vaginal discharge, but the urinary frequency, the white vaginal discharge, might be okay, but the urinary frequency has me concerned that maybe it's a UTI, maybe I need to, or something else is causing this urinary frequency I need to assess.
Oh,
Okay, so 4 is an infection or risk for infection. What's 3? Risk for what?
preeclampsia. Or
Okay,
Headache, mhm,
so which one is more of a concern?
preeclampsia.
You said it, nurse. Don't second guess yourself. You said it, you meant it. Stick to it, okay? There's no reason to change your mind there. How many things we got there? Gestational, hypertension, high blood pressure we got, right? After 20 weeks gestation without protein. That's 2. Development of protein with the hypertension. That's 3. Headache, visual disturbances, and facial swelling. That's 4. All right. And then complications, thrombocytopenia, liver dysfunction, kidney insufficiency. All right. So then you're going to have that HELP syndrome. So that's 6 things right there in the first paragraph. You know those 6 things, you can answer any question. Who's reading?
Nurses providing care to a group of postpartum clients. Which client comment should prompt further investigation? I feel so exhausted that I started taking naps when the baby sleeps. I have trouble sleeping well at night because I worry that I won't hear the baby cry. My aunt, oh boy, my aunt has come over every day to care for the baby because the baby cries bother me. And my spouse thinks that I have been more emotional since I've had the baby last week. So nurses providing care to a group of postpartum clients. Which client comment should prompt further investigation?
now why would the baby cries bother her?
Right, that's a question. And also the husband says that she's emotional since she had the baby last week, which is, I mean, you know, you can get postpartum, but how emotional and crying, or is she depressed? Like, do we need to look into that further?
Okay, so let's talk about 4. When do postpartum blues or further depression, when does it start to become a concern? When it's been longer than what?
2 weeks.
Okay, so this was last week, kick it out.
Mhm.
Okay, should the baby's cry bother a mother?
No.
When the babies cry I'm going to tell you when the baby's cry should bother you as a mother. Okay, the baby's crying, you go to the baby like you normally do, and you get a baby a bottle and it doesn't work. You go back, you change the baby's diaper, it doesn't work. You do this, you do that, it doesn't work. That's when the cry starts to bother you because you are not able to console your child, so you're concerned. Okay. Now, if the baby's cry bothers the mom at any other time, she's either depressed or lazy. She just don't want to be bothered with the baby. That's not her thing. She probably shouldn't have had the baby. Probably too lazy to use the birth control. So now she has a baby she don't want to deal with either. All right. Or severe depression. Those are the only 2 things that are going to make a mom not want to go to its baby. Right? Even crazy people want their babies. They just don't have the capacity to take care of them. And some people that are developmentally delayed want their babies. Sometimes they just don't have the capacity to take care of it. And the other things are normal, right?
Mm-hmm.
You feel exhausted and you want to take a nap when the baby sleeps, but as soon as you lay down, what's the baby do?
Right.
Wake up. And yeah, you're going to worry that you can't hear the baby at night. Now, when my baby was born, I lived in a house with somebody else who had a baby, and their baby died from SIDS while we were at a concert one night. So from that night on, every night I would be up with a compact lens from like a, you know how you get the makeup and it has the little mirror in there? And I used to hold that mirror over my baby's mouth to make sure it was breathing, because I would be freaking out thinking the baby wasn't breathing, because after that issue with the SIDS, like I was just totally freaked out the whole time. My daughter was like, until she got to be like 2. And I finally realized, like, okay, she's good now. So, 3 is definitely your issue here. There's no reason why the baby's cries should be bothering her. And 4 would be an issue if it was more than 2 weeks. Okay. Because your hormones and stuff are going to be released from having the baby. So your emotions are going to be all over the place. You remember that, right?
Yep.
Yeah.
If you got a baby. All right, so there's your time frames there.
The nurse performing an initial newborn assessment observes a bluish discoloration on the hands and feet. The trunk has a pink color. Which action by the nurse is appropriate? Apply blow by oxygen and count respirations. Auscultate heart sounds for a murmur. Observe the newborn for expiratory grunting. Place the newborn skin to skin with the mother.
Okay, so first thing you have to know is that a normal finding?
Yes.
Okay. Acrocyanosis, right?
Yep.
All right. How do we correct it?
You put the baby, wait a minute. You place the baby newborn skin to skin with the mother.
Kangaroo it.
Yep.
Remember, that's all because of that thermoregulation, right? The baby can't thermoregulate because of its immature system there, okay? So it uses that brown fat. It doesn't shiver. So we're going to use ways, if we can, non-invasive ways to warm this baby up. All right, so skin to skin is the best because you're going to get a double whammy out of that. You get the bonding and you get the increased warmth. The baby's blood sugar and stuff can start to drop if they don't warm up, because the body is going to start metabolizing and using up fat and burning energy and trying to heat itself up because it can't shiver. It doesn't have that ability. Okay, so here we go. We got a blood group of O, RH factor, that's a negative, increase in white blood cell counts. Platelets are a little bit low. Hemoglobin is low.
The nurse uses the laboratory. They will know you press that below. What you guys are actually. Will be the hemoglobin, right? Platelet count. Would it be the hemoglobin?
So where's this epidural going to go?
In the back.
Risk factors.
Bleeding.
So how would you monitor that?
Hemoglobin. Yeah.
Sure about that?
Platelet count, both of them.
Oh yeah,
platelet count was what?
It was low. It was like 90.
Low.
Yeah.
So is that a concern? Because your platelets have everything to do with what?
Clotting.
Bleeding.
Yeah.
Remember, hemoglobin is more about your red blood cell concentration.
Mhm. Let me copy it. So hold on.
Again, with epidurals, you're thinking about bleeding, you're thinking about hypotension. What else? Spinal cord compression.
Mm-hmm. Headache.
Okay, headache. Good. You know, what other things can you think about that are surrounding this? Because that's what's going to help you answer these questions. And then again, think about your hemoglobin is really more about your red blood cell concentration. So when it's increased, we're dehydrated or we don't have enough fluids. And when it's decreased, we're like diluted. We have too much fluid in our blood. So if we were in fluid volume overload, our hemoglobin could be, and our hematocrit could be decreased a little bit.
The nurse is performing the initial assessment of a newborn. Which findings should the nurse report to the healthcare provider? A sudden jarring of the client's crib does not produce a Monroe reflex. The client has a swollen labia and thin. The client has a swollen labia and a thin white vaginal discharge. The posterior fontanelles is triangular and smaller than the anterior fontanelles, and there are pearly white pinpoint papules on the client's face and nose. We're going to get rid of 4. That's normal.
Okay, that's that milky stuff that I forget what they call it, but it starts with an M.
Yeah.
What about 3?
They ain't triangular, are they?
Yeah, they're kind of triangular, and the back one's usually a little bit smaller than the front one. Why do we even have fontanelles?
That's for hydrocephalus.
No. So the fontanelles, what they do is they help align the pelvis during the birth process, okay? And they're soft. So it allows for that molding of the head so that it can go through the birth canal. So it can kind of squeeze the head, because if you had solid, hard bone there, it wouldn't be able to. And the baby either wouldn't be able to come out because it would get stuck, or it could cause some sort of trauma to the baby's head. So these fontanelles are kind of soft and squishy, and they allow the baby to come out through the birth canal. And then the one in the back will be a little bit smaller. Okay, and you can use these to assess for fluid balance in the brain. So if they're flat, which is what they're supposed to be, then that tells us the baby's fluid status is pretty much the normal. If they were bulging, then our baby might be in some kind of fluid overload. And if they were sunken in, then our baby might be a little bit dehydrated. So 3 is good. What about 2?
The labia is swollen with the female.
Swollen.
So, 2 is normal,
Mhm.
right? They are going to have a little bit of white vaginal discharge, not all of them, but some do. Why is 1 an issue?
Wait a minute. A sudden jarring of the client crib does not produce a moral reflex.
So what is the moral reflex?
That's when
So you're in the shower, right? You're in the shower, you're scrub-a-dub-dubbing, right? And your boyfriend or your husband or whatever trying to play around and be a smart ass around Halloween slides in and don't say nothing and grabs the curtain and opens it up. And what happens to you?
scream.
You jump, right? You jump out of your skin. You scream, yeah, but you kind of jump, right? It startles you. That's what the moral reflex is. It's a startle. So you ever notice if you clap your hands or you hit the crib or whatever, the baby jumps like out of its skin? That's normal. You want the baby to do that, okay? So 1 is a problem because the baby didn't do it.
Gotcha. Mhm.
Oh, Milia, that's what they're called. I couldn't think of it.
Yeah, you said it started with an M. I know what you were talking about.
I want to say milk because that's what I think about when I think about it. The little white pinpoint papples, I always think about milk because it helps me remember that it's normal because I like milk, right? I have to have little keys to associate everything. And guess what? 20 years from now, I'll still remember it.
Mhm.
Pregnant client comes in for a routine first prenatal examination. According to the last menstrual period, the estimated gestational age is 12 weeks. Where would the nurse expect to palpate the uterine fundus in this client? 12 centimeters above the umbilicus, at the level of the umbilicus, halfway between the symphysis pubis and the umbilicus, just above the symphysis pubis.
Mhm.
So it should be 12 weeks gestation.
Just above the symphysis pubis, right? Or halfway? No.
Oh, it's just
Say-
above.
I would say it would be 4 and 3 would be 16 to 20 weeks.
Yeah, just
Mhm.
above.
All right. Because you're thinking about finger breaths, right?
Right.
All right. So the baby grows according to how many fingers, right? Usually about 1 a week or so.
Mm.
Are you learning from this? Is this working?
Yeah.
Yeah, you world is always
Mhm.
always good.
Are you guys seeing about stuff like this? You know, are you talking about this kind of stuff in class?
Yes.
A pregnant client comes to the labor and delivery unit stating, "My water just broke at home." On assessment of the client's perineal area, the nurse visualized a loop of umbilical cord protruding from the vagina. Which nursing intervention should be appropriate? Apply suprapubic pressure, assist the client to the knee chest position, perform the Leopold's maneuver, perform the McRoberts maneuver.
So what happens first? What's going on with the patient? What are they presenting with?
Now, the McRoberts maneuver would be shoulder dystocia, so that's out.
What does your patient have? Because before you can make an intervention, you have to know what's going on.
The umbilical
What is this
cord
called?
protruding from the vagina.
So this is a prolapse cord, right?
Okay.
So what is the concern here with the prolapse cord?
Oxygen to.
Strangulation?
Mhm.
Not strangulation, but you're kind of along the line. It is going to impair circulation because we have compression on the cord. So we have to relieve that cord compression. So what is the safest, least invasive way to do that?
Assist the client to knee chest position.
Reposition that client and get them in a position where you can get that pressure off of the cord.
Right.
So I believe it is 2.
Yeah, I was looking for Trendelenburg to be in there.
So
But-
yeah, Trendelenburg you might see, and you also might see using a sterile glove hand to lift the presenting part off of the cord. So you actually lift with the hand. You don't do a vaginal exam or anything like that. You would just lift the presenting part so it's not compressing the cord. And then oxygen IV fluids. So you're right with the Roberts maneuver with the shoulder dystocia. And then Leopold's is for identifying fetal presentation.
The nurse is caring for a 1-day-old client at term gestation who is irritable, feeding poorly, and only sleeps for very short intervals. The newborn's mother informs the nurse that she has been taking hydrocodone. No, that's not Dean. Hydrocodone
Hydrocodone, okay.
on a regular basis for several years. Which intervention is appropriate to include in the newborn's plan of care? Avoid giving the newborn a pacifier. Position the newborn supine after feeding. Stimulate the newborn with light. Stimulate the newborn with light regularly. Swaddle the gentle. What in the world? Swaddle and gentle. Rock the newborn.
So what does the baby have?
It seems like they're going through withdrawal.
Okay, needle abstinence syndrome, neonatal abstinence syndrome, which is withdrawal from narcotics because the mother's been on narcotics for long term. So how do we treat these patients? First of all, how are they going to appear?
Irritable.
Yeah.
Yeah, they're irritable, jittery, poor feeders, okay, not sleeping. So what are we not going to do?
You don't want to like stimulate,
You don't want
overstimulate.
to
Right, we're not going to stimulate them.
Right.
How about 1?
avoid giving a newborn a pacifier.
I don't remember that one.
Yeah, I would get rid of that because you're not going to avoid giving the newborn a pacifier. If you need something to soothe them, you're going to give it to them, right? These patients may need it. They may need that sucking because that can soothe the baby sometimes. How about put the baby supine?
No.
Not after feeding. Well, you that's how you lay the baby, or lay them on the side. But you don't want to do that after feeding. Nah.
You don't want to stimulate, but swaddle and gently
Swaddle,
rock the
gently
newborn
rock.
is good.
Okay, so what's your answer?
Look like 4.
Okay, good. You'll see a lot of questions on this.
Yeah, I think I remember seeing that question.
Again, this is something that if you're a home care nurse, you know, you're going to see a lot of evaluation on this because they evaluate almost all babies when they go home from the hospital, especially if it's a high suspicion. But but usually there's a form that they have us do that kind of tells us whether or not they meet the criteria. And it's pretty obvious when they do. A lot of them out there, by the way.
The nurse is assessing a client at 30 weeks gestation during a routine prenatal visit. Which statement by the client should the nurse investigate first? I am not sleeping as well due to cramps in my calves at night. I have noticed less kicking movements as the baby grows bigger. Over the last few weeks, I have not been able to wear any of my shoes, and sometimes I feel short of breath after walking up a flight of stairs. First.
So we're at 36 weeks.
And this is a routine. She can be short of breath, the baby's grown. I wouldn't address that first. Over the last few weeks, I have not been able to wear any of my shoes. She has some swelling. I have noticed less kicking movements as the baby grows bigger. And I'm not sleeping as well due to cramps in my calves.
That's normal, ain't it? You the like cramping in your leg cramps.
Like the Charlie horses?
Charlie horses. There you go.
The movements of the baby. Maybe I should do, we should do an assessment, the baby should be moving, kicking at least, move its arms, stretching.
Okay, sounds reasonable. You have to be concerned whenever the baby's movement starts to slow down for some reason. All right. Good. They tried to get you with those leg cramps.
Mm-hmm.
All right, read this one. I gotta go to the ladies' room.
A client at 20 weeks gestation reports running to the bathroom all the times, pain with urination, ooh, foul smelling urine. Which question is most important for the nurse to ask when assessing the client? Are you having any pain in your back and flank area?
Isn't the flank area, is that where, in your back, flank area where your kidneys, is pain and urination and foul smelling urine. It's an infection, right? That's most important for the nurse to ask. Well, on assessment, probably you would have that low back pain, right?
Okay,
So
are you having
important? Do you wipe from front to back after urinating? Front to back, right?
That's right.
Mm-hmm.
And you're gonna go to the bathroom, you pregnant.
Is that right? And have you had a urinary tract infection in the past? I mean,
1 of 4, but
yeah.
one sounds a
That sounds related to having an assessment, number one. Trying to find out if they have lower back pain, lower back or flank area. Leaning towards 1.
Sorry about that. I couldn't hold that one any longer. All right.
So
What did we
we
come up
narrowed
with?
it down to 1 or 4, and We're leaning towards one, the strongest out of 1 and 4.
Okay, 1 is further assessment. 4 might be important, but 20 weeks gestation. Okay. So a couple different types of UTIs here. I never used to like UWorld, but they came up a lot.
Mm.
Who's
I
reading?
feel like their questions are more time consuming, but you get a lot out of it. Because I was using it a lot in the LPN. And it would take me longer to get to these questions, but I got a lot out of the little bit of questions that I got through.
They're very informative. I don't think they used to be as informative as they are now. For me, I feel like they're very informative and they bring you just the facts. So that's what I like about them.
Mm-hmm.
If you learn the facts about everything, then you can start to comprehend it and how one thing works with the other, and it will help you to put 2 and 2 together quicker.
Mm.
But I see y'all working hard out there. I see your grades showing some signs of improvement, and so that's a good thing.
When triaging for pregnant clients in the obstetric clinic, the nurse should alert the healthcare provider to see which client first. First trimester client reporting frequent nausea and vomiting. Second trimester client with dysuria and urinary frequency. Second trimester client with obesity reporting decrease in fetal movement. And third trimester client with right upper quadrant pain and nausea. So which one would we alert the healthcare provider about first? Number 1 is normal. In the second trimester, pain and frequency.
Painful urination.
Frequency. That don't sound good.
But we will see that patient first, and then you got the decrease in fetal movement.
That's what we should see first. Well, that's second try. Baby should be moving.
Obesity reporting decrease fetal movement.
The third trimester, right upper quadrant. So you got right upper quadrant, the liver's up there, the gallbladder's up there. She's having nausea, but she's not vomiting. But that decrease in fetal movement in second trimester.
Well, and if I just didn't know, one of these things is not like the other, one of these things is different, you know, because one's talking about the baby and everything else is talking about the mama. And I don't know the answer here, but I'm guessing that it's 3 just because it's talking about potential fetal demise. The others are talking about, you know, possible urinary tract infection. You know, 4 could be a number of things. Oh, it was 4 though. Look at that. HELP syndrome. And that's why.
Help.
That HELP syndrome. I forgot about that right upper. And I said there's something about that right that's going to kill me on this one. That was it. So 3 was incorrect because the altered obesity could influence the movement. And I was kind of thinking like I was just kind of thinking the opposite of that, like we shouldn't rule it out just because she's obese. But I guess that it kind of says that you should, huh? I mean, not rule it out, but
Right. See the other one first.
Yeah, you should consider that a potential factor. So, okay. That's one of those things where you see the fetal situation, and so you go with that because, you know, that's what your gut tells you. But again, why you really have to comprehend everything about the subject in order to really be able to answer any question about the subject. You don't have to answer every question about the subject anyway. There's some room for error, but the more you know, the better chance you have of doing well.
The nurse is caring for a client at 39 weeks gestation in active labor who is receiving an oxytocin infusion. The nurse notes persistent late decelerations on the fetal monitor. Which of the following actions should the nurse take? Administer oxygen via a non-breather face mask, change maternal position to the left side, discontinue the oxytocin infusion, notify the healthcare provider, perform a nitrazine test. She's 39 weeks. Discontinue the oxytocin, decelerations because of the on the fetal monitor. So change positions.
Change maternal position. Administer oxygen. Oh, you know, be there. Notify the healthcare provider.
And submit.
Good job. Veal chop. So just in case you didn't know, the nitrazine is for detecting leaking amniotic fluid.
The nurse is performing the initial assessment of a newborn. Which of the following findings should the nurse report to the healthcare provider? Select all that apply. A single artery in the umbilical cord. Ava.
There's 2 arteries, one
The
vein.
arteries, one vein, yeah.
So you want that?
Yeah, we have to
Decrease
report.
muscle tone.
Yeah, you wanna report decreased muscle tone
Muscle tone, yeah.
and sacral dimple. Wait a minute, what's that measurement? 0.4? Skin tag. And the heart rate is between 120 and 160, so that's good. And number 1 is normal.
Yeah. Mhm.
Sometimes with that heart rate, you might even see 110 to 160, okay?
Yeah, I've
Depending
seen
on the
it.
author.
I've seen that too.
Okay, just so you guys are a little bit aware of that. All right, good job.
The labor and delivery nurse is caring for a Japanese client who has declined epidural anesthesia. The client has been very what is that?
Stoic.
Stoic, meaning quiet while in pain. Oh yeah, it finished it, and quiet throughout labor. Which nursing action represents the most appropriate care for this client? Complete hourly pain assessment using a numeric pain scale. Document that the client appears to be experiencing minimal pain. Monitor for nonverbal signs or ineffective coping with labor, and recognize that the client's stoicism is ineffective coping with labor.
Stoicism.
I can't say
So
words.
her behavior is actually, that's what it's saying, that her behavior, her withdrawalness is her way of showing that she's not effectively coping with this labor.
So which nurse in action represents the most appropriate care for the client?
Nursing after the response represents the most appropriate care. But she declined the epidurals. This is a cultural, I think 4 we can rule out. Ineffective coping with labor. Monitor for non-verbal signs of ineffective coping with labor. Why does 3 and 4 sound the same almost?
Monitor for nonverbal signs of ineffective coping with labor.
Complete hourly pain assessment using a numeric pain scale. I would do.
I would do that. Ask her.
Document the client appears to be experiencing minimal pain. I would do 1. I think that's most appropriate care for this client. It might be stoic and quiet throughout labor, but that's culturally, maybe that's how they deal with pain. So the only way to know that she's in pain is to ask. The numeric pain, the assessment.
So I'm between 1 and 2 on this because I'm not sure that 1 will work, that she'll be able to use a numeric scale. That would be my only concern with that, but let's see what it says, because sometimes you guys are right and I'm wrong.
So it's monitor.
Wow, monitor for nonverbal signs of ineffective coping with labor.
I was torn between 3 and 4.
So again, knowing that it's culturally appropriate means that she right now is coping, but you're going to monitor her in case something changes and she's not coping, which would be one of those other things: crying, sweating, screaming, panicky.
The nurse is performing an APGAR assessment on a newborn client at 1 minute of life. The newborn is completely blue, has a heart rate of 110, is imitating a weak cry. Active movement and flexion of the extremities are noted, and the newborn grimaces when nares are suctioned. Which APGAR score should the nurse assign this newborn? Ooh,
What
okay.
is it doing?
So that's 1, has a heart rate of 110. 3. 4, 5. 6.
The higher the score, the better.
It's like the 5 or 6.
Which, so when the baby is completely blue, has a rate of 110, is probably 4. Active movement and flexion of extremities, 4 or 5 are noted. Active movement and flexion are noted. And the newborn grimaces when nares are suction.
So that's a 1, right? So that's 1. Heart rate is 2.
It's yeah.
Flexion is 2. So that's 4. That's 5 right there. I'm torn between 5
2.
6. But you might be right with the 4. I gotta figure out how to count that.
What
So
you
what
think?
y'all want? 4 or 5?
5.
Let's go with 5.
It was
It's 6.
6. Okay. There was 1 more point for what? The color?
Uh-huh.
Oh, there was 0 points for the color. The grimace.
The grimaces was what? Is 1 point, right?
Some
The
point.
heart rate was
It's
blue for the body. Weak
every
cry.
up
What
to
was
20
1
minutes.
point for the weak cry? Nasal suction grimace was 1 point. Flexion is 2 points. So that was 4. That make it 4. Heart rate is 2 points. That makes it 6 because it was over 100.
That don't look good.
Laboring client with epidural anesthesia experiences spontaneous rupture of membranes immediately followed by an abrupt change in the fetal heart rate. The nurse knows that considering the probable cause of the change in the fetal heart rate, which action should be taken first? Well, I don't know. That's concerning. I might just notify the healthcare provider with this one.
Well, they bleeding, right?
It's an abrupt change.
They bleed. You got to do something.
Yeah, the ruptured membranes. It's already there.
So are we going to notify the physician, or are we going to start off with some
Alternate the side.
Well, you probably can do an intervention first before you notify the physician, right? Because you need to change something in this status.
So if she's
Physician's going to be mad if you don't. Now,
if
if you assess, okay, that might tell you what's going on, but is it going to help the client?
Nah, not right now. So I have a question. So she premature rupture of membrane. So that means she could be possibly hemorrhaging. Don't you want to give her fluids?
Possibly. I'm kind of thinking that there's some kind of compression on the cord.
Okay,
So maybe it is too.
Umbilical cord prolapse.
Going to the alternate side. I'm thinking, because if you look at that's what it looks like, that there's some kind of cord compression.
All right, I see what you're saying. We're turning the patient.
So I need to do something to address that is what I'm thinking. So it could be too. Because then if I do that, then I know what I need to do at that point, which is reposition, but not to the side. I need to either lift that presenting part off of the cord or put the patient in the knee chest or the Trendelenburg position, if that's what's going on, not on the side. Fluids isn't going to help if you're not getting, if the cord's compressed.
Right.
And I don't like to the alternate side because I don't know what side they're on. If they're on the left side, I might not want to put them to the right side.
Right.
And I feel like before I call the doc, I need more information or he's going to scream at me. So that really narrows me back to 2 just because of that. Again, I'm not sure that's the right answer, but
assess. It's the right answer. Cord prolapse. No.
You guys want to do the math or no?
No, gonna wreck my brain.
The nurse assistant.
I haven't even had my coffee yet.
Well, we know what that is, right?
Yeah.
The Mongolian booty smack.
The nurse assesses a newborn with skin discoloration in the lumbar area as shown in exhibit. What would be an appropriate action for the nurse to complete? Assess the infant's hemoglobin, hematocrit, and platelet, measure and document the size and location of the markings, notify the healthcare provider of the markings immediately, or review the delivery record for evidence of a traumatic birth.
Anything normal? That's normal.
Yeah, that's not,
To
yeah,
measure and document,
it's
right?
not traumatic, right?
Okay.
Which assessment finding would the nurse most likely expect to find in a male infant born at 28 weeks gestation? Abundant lunigo on shoulders and back, deep creases and pilling skin on soles of feet, flat areoli without palpable breast buds, smooth pink skin with visible veins, and testes completely descended into the scrotum. And a male born at 28 weeks gestation. Which assessment finding would the nurse most likely to expect to find?
So one, abundant. Deep creases and pilling. Now that's on the term baby, right? Flat areola with palpable breast bud. And this one's gonna be new hole. RF.
So this baby's pretty young, right? Just barely viable. What are you going to see in that preterm?
You gonna have a lanucle, right? On the
Okay. I would say those buds probably aren't popping.
yeah, that could be flat areola with palpable breast bud. Okay.
What about the testes? You
The
think those are
testes.
fully descended yet?
Nah, not yet.
And what about the skin?
It ain't gonna be smooth and pink. Mm-hmm.
With visible veins.
It could be. That's a possible.
Anything else?
Yeah, it was a smooth skin, smooth and visible vein. Let's see about them testing.
They're developed at 28 weeks.
Develop. The testes of male 20 would not have yet descended into the scrotal sac and may be palpable in the inguinal canal.
I was just thinking about the visible veins, like you don't see the veins when the baby's born, so the skin's kind of thin still. That's what I was thinking about.
Mhm.
All right. Oh, whenever you guys, I got a couple more minutes for when my next session starts. So, anytime we can call it. You want to go another 15 minutes? I'm good with that.
A client with prenatal care gives birth to a newborn at term gestation. The client denies opiate or other illicit drug use during pregnancy. When monitoring the newborn, which of the following signs would indicate neonatal absence syndrome to the nurse? Meconium, ileus, and floppy muscle tone. Oh,
Irritable restlessness.
yeah. Would it be 1, 2, and 5?
So 1, 2. Yeah, I would say probably 4 also.
Yeah, because they sneeze a lot too.
Sneezing.
Oh, I didn't know about 2.
Oh, he's at term, so he wouldn't have the meconium.
Not the floppy muscle tone either. I didn't see that. It would be more rigid and jittery.
Yep.
So like these babies, we're always putting like in the back, like in a quiet area where it's dark and all that stuff, because they need a lot of that real destimulation and all. They're really hyperactive, and little things like, their Moro reflexes like overstimulated as well. So like every little thing makes them jump or jitter or shake.
Client indicates the desire to become pregnant. Which of the following are important preconception education topics for the nurse to provide? Aim for a BMI of 18.5 through 24.9. Avoid alcohol consumption and tobacco products. Ensure daily intake of 400 mcg of folic acid. Obtain testing for rubella immunity. Schedule dental wellness appointment. So which of the following are important preconception education topics? Avoid an alcohol. The folic acid. The rubella is important too.
What about the aim for a BMI of 18? I think it's 24.20. Is it 24?
18.5, and that's normal.
That's normal. So you want to be in between that weight. I don't think you gotta schedule a dentist wellness appointment, do you? That's during pregnancy. You gotta get your teeth checked.
Well, wouldn't you want to get them checked before?
Yeah.
Yeah.
I mean, because once you're pregnant, if you have to have stuff done, it's hard because, certain drugs and stuff you can't get. The babies just suck the life out of your teeth.
Oh, look at that. It's all of them.
Okay, good job. Good job.
The nurse is preparing to teach the parents of a newborn about newborn safety. Which instruction is appropriate for the nurse to include in the teaching plan? Dress the newborn in a wearable blanket, such as a sleep sack during sleep, if an extra layer is needed. Layer the newborn with jackets and blankets before securing in the car seat. Now, place the newborn in the place the newborn car seat. One is the only one that sound right, but I can be wrong. That's appropriate.
Sure enough.
Can you go back up? Oh, well,
Yes, I can go back up still.
my aunt had called me during this question. Hold on. Okay, thank you.
You're welcome. You need the rationales now?
No, I kind of remember this.
Okay. Did I lose y'all? Hello?
Still here, I think it's number 4 if everybody read it.
Oh, okay.
Client gives birth within an hour of arriving at a labor and delivery unit and delivers the placenta 5 minutes later. During assessment, the nurse notes that the uterine is midline and boggy. Which action should the nurse take first? Check for pooled blood under buttocks, increase IV oxytocin infusion rate, monitor blood pressure and pulse, perform firm fundal massage.
So four.
Somebody's talking, but I can't hear you.
Oh, 4.
I think it's you, Takesha.
Yeah, 4.
It just sounds real muffled. Now I hear you.
4.
Massage the fundus.
Yes.
That's the only thing I really remember from nursing about maternity. Massage that fundus. What are you going to do if something goes wrong with the patient? Massage the fundus. They used to just push the crap out of that. All right, here's your next one.
The nurse is reinforcing education to a group of clients that are pregnant or planning pregnancy. Which of the following client statements about alcohol use in pregnancy should concern the nurse? If I drink, okay, as long as I don't binge drink, an occasional glass of wine is fine. That's a no-no. I drank alcohol heavily before realizing I was pregnant, so there's no benefit to quitting now. Up to. If I drink alcohol, my baby may have withdrawal after birth, but no permanent damage. Oops, number 3. It is important to stop drinking while I'm pregnant to conceive. Okay. Third trimester alcohol use is less harmful because the baby is 5. She's just gonna drink. 4 too, right?
It's important to stop drinking. Wow, I am trying
No,
to.
no, no. 4 is no problem.
Yeah, that's fine.
Oh, wait a minute. If I drink alcohol, my baby may have withdrawal after birth, but no permanent damage. That's
Wrong.
that's
Yeah.
wrong. Yeah.
Only one we want to leave out is 4.
Yep.
Okay, good. I'm just putting that up there and leaving it for a second because we're recording, then it's going to put it up there. All right. So anything out of whack there?
The hematocrit, that hematocrit is low. The red blood cells is good. The white blood cells is good. And the platelets, they're good. So hematocrit is off.
Really, those white blood cells are okay?
White blood cells,
They're low, right?
they should be between 10. Hold on, white blood cells should be between 10,000 and, or from my notes, 10,000 and 30,000.
What?
No.
White blood cell, hold on. White blood cells,
Come on, nurse.
10,000 and 10,000.
About 4,000 to 10,000.
Okay. It was 10,000. That's number 4.
okay.
They're high.
Okay.
All right, so they're high, and then the hematocrit,
That's a little.
that's low, right?
I mean, it's a little low. It's not crazy low.
Very test results for a pregnant client at 32 weeks gestation. What is the nurse best action based on these results? Complete the client assessment and documentation, draw another sample for repeat complete blood count, prepare for transfusion of packed red blood cells, request a prescription for iron supplementation.
So if you're going with your hematocrit's a little low,
Mm-hmm.
your red blood cells are 5,300. I mean, your white blood cells could maybe be a little elevated in pregnancy. I don't know what normal is in pregnancy. I don't know if there's maybe an expected elevation there, since I really don't see anything addressing that. It looks like it's addressing more to the fact that either the hemoglobin's too low or the hematocrit is too low or something along that lines.
We're talking about, hold on. All right, see, I'm confusing the lab values with the test results for a pregnant client. Now, the white blood cells in a newborn is what I had in mind. All right, so that explains that. Okay.
Complete the client assessment and documentation.
It's all not that bad. Request of,
I mean, we'll draw another CBC, but it doesn't have to be right away.
Well,
if it goes towards that route, can we just give her some iron?
Right.
Well, yeah.
well, is her issue, what would you give iron for? Why would we give iron in a client?
Anemic.
Okay, so what would prove anemic?
Her hemoglobin.
Okay,
What
so
happened?
11.4 is too low. You would like to see it where?
It should be over 12, right?
Okay,
12, 13, maybe 13. Something.
so you're thinking 4.
Yeah,
Anybody else?
yeah. Complete the client assessment and
Complete the documentation is not that. Let me
hematocrit.
get a copy of the labs. So wait a minute.
You want me
Platelet,
to keep it there?
yeah. Hemoglobin is 11. Hemoglobin is 11.
So this is during the third trimester, okay?
Greater than 11. Hematocrit
Oh, as long as it's greater than 11, she found.
greater than 33.
Hematocrit greater than 33. RBCs. Okay. And then platelets, 150,000. That was at 150 to 400,000. Okay.
So it's normal for them to have these because they're in a hemodiluted state called physiologic anemia of pregnancy,
There you go.
which results in a lower hemoglobin and hematocrit value. It's also normal for the white blood cell count to increase during pregnancy. So again, this is what you have to know, what's normal versus not normal.
Right. Well, our 2 hours coming up.
And why? They have a total blood volume increase to meet the increased oxygen demand and nutritional needs of that growing fetus and maternal tissue. So the increase in plasma volume is greater than the increase in red blood cells, creating this hemodiluted state, termed physiologic anemia of pregnancy, which is reflected with the decreased hemoglobin and hematocrit. Good stuff there. Okay. All right, guys, last one. Now remember what we said about magnesium. What does it do?
It slows it down, right?
Brings everything down. Good. Okay.
Want to help with seizures.
Also preterm labor.
Yep.
All right. So if it brings everything down, what would be a sign that we're toxic?
Ooh, bring it down. Respiration's a 10.
Okay, they're slowed down.
Magnesium. What's the mag? Oh, but
So deep tendon reflexes, are they going to be hyper or hypo?
they're gonna be hypo.
Blood pressure going to be high or low?
Gonna be a little lower than that.
Okay. Magnesium level going to be high or low?
Gonna be low.
Is it
No,
going to be
no,
high
it's gonna be
or low?
high.
It'll be
It's
high if it's toxic.
gonna be toxic, yeah.
Are we going to put urine out or are we going to hold it?
Should be holding it. And that's putting out there 600 times 8.
But,
Yeah, that's putting
well,
out.
600 mLs in 8 hours, that's not bad. You 200, you're gonna avoid 200 maybe in every time you void. So that
30 an hour,
250,
like 240 in 8 hours. If you're putting out 30 an hour.
yeah.
Right.
In 8 hours, yeah, I've seen like 1,000. I'm not
So you want
sure.
3 or no?
No,
You want to go with the 3?
no.
Okay.
Well, Natalia, you want 3?
You want, yeah.
Too late.
Yeah. Well, it was right.
All right, so calcium gluconate is the antidote. You want to know about magnesium. You want to know all this stuff, okay? Because you're going to get tested on it. If you don't know all this, you can't. All right, urine output greater, is it greater than or less than? I forget these signs, these stupid signs. That one's less than 30, right?
Let me see.
That's less. That's less
Of
than
less
30.
than 30. So urine output would be decreased.
Right.
Mhm.
All right. Because the kidneys excrete magnesium through the urine. And cardiac arrest also can happen to this patient. But if you just remember, usually when someone has too much of an electrolyte, everything's going to be decreased. When someone has not enough, everything's going to be increased. So if I'm hypo, I'm going to be hyperactive, hyper everything most of the time. If I'm too high, I'm going to be sedated, low, down. All right, so especially when you're talking about magnesium, calcium,
So
potassium.
hyper will be decreased.
Yep.
Got it.
Which, I mean, if you just think about in a person with preeclampsia, what's happening, their blood pressure is rising, they're at risk for seizures. So we're giving them that magnesium to bring things down, right? To
Yeah.
stop that seizure, to bring that blood pressure down. And the kidneys excrete it, so those have to be working. All right, you ladies have questions. Hopefully you learned something today.
Yep.
No questions. Thank you. This was good.
Yeah, this was actually, thanks, sir.
You're welcome.
Have a good rest of the weekend.
Thank you. Y'all too.
Have a good-
I'm gonna I'll stop it and then it'll process, and once it processes, I can load it to YouTube, and then you'll get a private link for it. That'll be
Okay.
the only way you can access it. All right.
All right.
Thank you.
All right.
Thank you.
Bye-bye.
Bye-bye.